I work in a teaching hospital in Central Florida, and we have a spinal cord injury unit. And so we have patients that stay and have their PICC lines for not just a couple of weeks or a couple of months, but even over a year. And so if your catheter comes out 1 centimeter per week with the dressing change, then after 6 weeks, you have 6 centimeters of catheter out, and you have a serious problem. We first learned about SecurAcath at either an AVA or INS conference, but at a professional seminar. It has been an absolute game changer, because now our catheters stay in for the entire duration of therapy. So our practice became, if you're going to put in a PICC line and you know it's going to be in for more than 2 dressing changes, you need a SecurAcath. So that was it. More than 2 dressing changes, you need a SecurAcath. So we also have midlines that we know that this is going to stay in for more than 2 dressing changes. So we say, okay, why not go ahead and put a SecurAcath on it? If you're going to do it for the PICC, do it for the midline. So then you also have patients in the ICUs that are confused or they're sedated, and you know that as you wake them up, they're going to start pulling things. So even though we knew the line was only going to be in for a week or 2, so we say, okay, we know this patient's going to be confused or disoriented as they wake up, we're going to put securement on it. So even though it was short term, it got securement. So we started doing the same thing with the midlines. If you know it's going to be in more than 2 dressing changes, if you know the patient is confused, the patient has Alzheimer's or dementia, or even palliative care, and we're giving drugs that we know are sedating, or that we know the patient's confused, we know that they're sundowning, we know the patient has these problems and they're pulling and picking, so put securement on it. So we don't get called back to palliative care to put in lines that the patient pulled out anymore. We don't get called back to the ICUs because the patient woke up and pulled out their line. So it's been an absolute game changer.